The president flew to Texas, where he called out the state's lawmakers for not taking full advantage of the Affordable Care Act.
They're already in place. One of the things that sometimes gets me a little frustrated, folks who are complaining about how the website's not working, and why isn't Obama fixing this, and all these people are uninsured, and yet they're leaving 1 million people right now without health insurance that they could immediately fix. There's not a lot of logic.
Republican Congressman from Texas, Michael Burgess, sits on the House Energy and Commerce Committee. Congressman, it's good to see you. Now, while they may not all live in your district, what do you say to the president's criticism that by not opting to expand Medicaid at least, 1 million people who could have insurance in Texas do not?
Well, let's get a couple of things out there at first. Medicaid will continue to exist in Texas as it has. So for blind and disabled, certain pregnant women, that coverage does not change with or without the Affordable Care Act. 25% of the state budget right now is spent on Medicaid. I think Governor Perry was wise in his decision to say not so fast. Look, when the Supreme Court changed the equation on Medicaid expansion.
Congressman, before we get to that, I want to go back to what you just said, because I think it's important here, especially for our viewers who are watching and listening, to understand that there are 6 million people who don't have insurance in Texas alone. And by expanding Medicaid in that state, 1 million people would have insurance. And here's the other part of this. Folks in Texas who pay federal income taxes like they're supposed to, they're paying for the service anyway. Why not take advantage of it? Why not let Uncle Sam shoulder some of the cost of health care in that state?
Well, let's look at this rationally. When the Supreme Court said that the federal government cannot coerce the states to expand their Medicaid programs, it gave Texas an opportunity. Let's see what happens in other states that are expanding their Medicaid.
How is that rational?
It's absolutely rational. How is it rational to expand a broken program? I mean, why in the world, if you were going to reform health care in this country from soup to nuts, would you expand Medicaid? Any doctor in Texas will tell you right now, Medicaid reimburses between 25 and 33% of the cost of delivering the care. You can't keep your practice open by seeing Medicaid patients, and that is one of the sad truths. Let's see what happens in other states. Let's let other states have an experience with this before we move forward. And look, the broader issue
and what happens to the millions who are uninsured in Texas?